is the Emergency Medical Minute.
Okay, I was at Belmar yesterday during the day, and I saw, a bazillion patients, but I saw an unbelievable number of people with flu-like symptoms, and obviously we've seen a ton. And a lot of times people aren't that sick. A lot of times they are. Most of what we're doing is just kind of reassuring. But, I've kind of refined how I explain what the flu is and how it's treated and what to look for our patients. Because I think especially this year, even compared to other years when we see the ugly flu seasons, I feel like maybe I've seen more patients that are worried. And what are they worried about? They're worried about dying. That's what they're worried about. There's been a ton of media reports, or at least I've seen them, that have all been exactly the same report, whether you see it on the local news or whether you see it on CNN or wherever. And they're basically, here is John Smith, totally healthy, father of 3, no medical problems, had flu-like symptoms, went to the hospital, was discharged, and the next day he was dead. How could they discharge them? And then they don't go into anything else. No explanation. And we all kind of know how it works. I mean, with the flu, the vast majority of healthy people who die, and who die really quickly, have some kind of other complication, like myocarditis, which is really common that'll happen. And it's one of those things that's incredibly sad, hard to treat, and is kind of a spiral that happens incredibly quickly. But we know that the vast majority of people with the flu do well. And we kind of know the people who are not going to do well, the people with extremes of age, the people with other significant comorbidities. So when I talk to a patient who is pretty healthy, has the flu, I'm thinking about sending home, kind of the way that I'm sitting down with them is telling them that, when 100 people have the flu, 98 or 99 of them are going to do great. They're going to be sick. They're going to be sick for a week, 10 days, 2 weeks. They're going to feel rotten, but the vast majority of them are going to do great. And I said, I usually tell them that I go through kind of the supportive treatment that we're going to do, whether we're going to use Tamiflu or not, whatever. But then my big discussion is that, the one thing that's hard to predict is who those 1 or 2 people are that are going to do poorly and are going to get sick. And I said, as far as medicines come, we haven't figured out how to predict those patients. And these are the people who I'm talking about who have already decided we're going to send home, not the super sickies. And I said, I tell them, I said, there's really not much that we can do to predict it. We'd rather be safe than sorry. I kind of give them the risk. If things get worse, you come back, and do my best to reassure them. So I definitely address it because I think that's what patients are worried about. I also address how it's hard for us to figure out who those people would be, so they need to be cognizant of their symptoms and come back and see us, and to really, not make it like, you're not sick, go home kind of thing, because that's when I think you get into kind of or misunderstandings that lead to finger pointing, that lead to people being upset. And so it's not really just a patient satisfaction thing. I think it's actually a helpful intervention that I think probably in the long run helps less people come back to see us, and kind of explains things more accurately and does them justice of understanding the disease process. So you guys all know that, but I just feel like I've sat down a little bit longer, spent a little bit more time with patients, and kind of explained what to expect and some of the unpredictability of the disease, and I feel like it's been helpful.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.